Hello, welcome back again to this channel where we talk about the basic medical information making a difference. We believe if you have the right information, you will be able to make a difference in your life or to somebody's life. My name is Rebecca Morangi. This is the best place to be. For the new subscribers, thank you so much for joining us. Kindly give the video a like. For the returning subscribers, thank you so much for always coming back to watch my videos. Today we are going to look at goiter. What comes in your mind when you hear the word goiter? Let's start by defining goiter. Goiter is the enlargement, overall enlargement of the thyroid gland, or somebody can develop a lump or a nodule on the thyroid gland, which will make the thyroid gland to enlarge. We have been talking about thyroid gland in different aspects. Let us remind ourselves the anatomy of the thyroid gland. The thyroid gland is a butterfly-shaped endocrine gland situated in front of your neck and below the Adam's apple. The thyroid gland secretes or manufactures the two major hormones, that is thyroxine, that is T4, and triiodothyronine, which is T3. Also, we have what we call calcitonin. Now, what are the functions of the thyroid gland? The thyroid gland performs different functions. We have metabolism, we have mood control and excitability, we have regulation of body temperature, digestion, and many others. Now, what can we associate goiter with? We can associate goiter with irregular production or imbalance of the thyroid hormones, what we call hypothyroidism and hyperthyroidism. We can also associate goiter with what we call euthyroid, the normal production of thyroid hormones which are balanced. Now, who can develop goiter? Actually, anyone can develop goiter, but the risk increases when you are 40 years and above. All women, mostly if you are assigned a woman at birth, you have a high risk of developing goiter. People who have a problem with metabolic syndrome, obesity, if you are obese, you have a risk. Those who have a problem with insulin resistance. Also, those people who have what you call family history or thyroid disease. If you have been exposed to head or neck radiations, you can develop goiter. Also, the most important thing again, if you lack what you call iodine, mostly we get from the diet we take, you can get goiter. Classification now. How do we classify goiter? Goiter can be classified in two ways. One, in the way it grows, And again, the level of the thyroid hormones. The way it grows, we have what we call simple goiter. This is where the thyroid enlarges and it swells and it feels smooth when you touch. We have what we call nodular goiter. Nodular is when you develop a nodule on or a lump on your thyroid gland. Another way we can classify it is through what we can have multinodular goiter. Multinodular means you have several or many nodules on your thyroid gland. Those are the three ways you can classify goiter on the way it glows. Now, how can we classify it on the level of thyroid hormones? One is what you call toxic goiter. This is where the thyroid grows in size or it enlarges and it produces too much thyroid hormones. The second way you can classify it under the level of thyroid hormones is non-toxic goiter. This is where the thyroid, yes, it enlarges, but it produces the normal thyroid hormones. They are balanced. They are not neither high or low, what we call euthyroid. Now, what can we associate this goiter with actually after classifying it? Now we can associate goiter with irregular balance of thyroid hormones, hyperthyroidism or hypothyroidism, and what we call euthyroid. Euthyroid, the normal levels of thyroid hormones. What are the symptoms of goiter? One, mostly the goiter can grow, or some people don't even notice whether their goiter or the thyroid has grown or enlarged in size. So many times one symptom is it's unnoticed. You cannot actually notice that. But you can notice a lump or a swelling on your thyroid. Another way you can get the symptom is through pain. You have pain when you swallow something. Other goiters are painless. Actually, you don't even have any symptom on your thyroid. You can feel some tightness on your neck. Another way is you're having difficulty in swallowing. When the goiter has grown, you can have problems in swallowing. Others have a problem when breathing because the windpipe is compressed. Other symptoms can come as a result of hyperthyroidism or hypothyroidism. Hyperthyroidism, remember the symptoms can be increased or heartbeat, weight loss. Some people can develop what we call diarrhea, fatigue, muscle weakness, agitation. Some people get annoyed. Now, those are some of the symptoms when you have a condition we call hyperthyroidism symptoms. What if you have hypothyroidism? Hypo, many people get constipation. They have weight increase. They put on a lot of weight. And others, they have dry skin. Those are the symptoms when you have what you call hypothyroidism, fatigue, muscle weakness, which is the same as hyperthyroidism. Now, those are some of the symptoms which you can notice in somebody who has got goiter. Now, what are the causes? Your thyroid tries to adapt itself so that either to produce the thyroid hormones to work well. So one of the causes, if you have what you call iodine deficiency, your thyroid will try to enlarge in size in order to produce the thyroid hormones. So if you lack iodine in your diet, your thyroid gland can enlarge in size. Another thing is what you call Graves' disease. Graves' disease, actually, this is where your immune system attacks the health cells of the thyroid gland. And then your thyroid will increase in size. Another cause can be what you call Hashimoto's, where your thyroid gland actually becomes inflamed. So when your thyroid gland becomes inflamed, it grows in size. Another thing is what you call pregnancy. During pregnancy, women produce what we call HCG. This hormone can make someone to have the thyroid gland enlarging or increasing in size. Thyroid cancer can cause your thyroid to enlarge. Thyroiditis, this is the inflammation of the thyroid gland. It can also cause your thyroid gland to enlarge or to increase in size. Now, what is the diagnosis of goiter? How can you diagnose goiter? One is through physical examination. You can feel or you can see a swelling in somebody's neck. Another way, you can do what you call thyroid blood test. What are you testing? You will test the T4 and the T3. Sometimes they test also what you call TSH, thyroid stimulating hormone. Another way you can diagnose goiter is through what we call antibody test. The proteins which are manufactured by the white blood cells or produced by the white blood cells in the body to prevent the body from some infections. So they do a blood test to check whether there is something looking as a form of goiter. So that's when they do an antibody test. They can do what we call thyroid ultrasound. Thyroid ultrasound is where they use high frequency sound waves to look at your thyroid. And mostly they use this to check or to detect whether you have what you call thyroid nodules. Another test they can do is what you call a biopsy. A biopsy, they remove some cells from your thyroid, which will be taken to the laboratory to do some further investigations. There is another test where they do what you call thyroid uptake scan. They inject what you call a radioactive iodine into your vein, which will show how your thyroid gland looks like. And finally, they can do what you call a scan or MRI if you have large goiters, which is maybe Crohn or spread. How can you treat goiter? One, it's through what we call thyroid or surgery. Surgery here, they can decide to do what we call thyroidectomy, removal of the whole of the thyroid gland, or lobectomy, they will remove half of your thyroid gland. That one will be followed by hormone replacement therapy, thyroid hormone replacement therapy by taking levothyroxine. Actually, some people will take it the whole of their lives. If they do total thyroidectomy, removal of the thyroid gland, you will have to be on levothyroxine the entire of your life. So another way they can treat goiter is through what we call radioactive iodine treatment. radioactive ion treatment. This is where actually you are given a radioactive ion material, and then it will shrink the cells in your thyroid. What happens if the cells in your thyroid shrinks? It means your thyroid gland also will do what? Will shrink. Again, this one will be followed by what we call thyroid hormone replacement therapy by taking levothyroxine the entire of your life. Again, it can be treated by the way of medication. How? If you have what you call hyperthyroidism or overactive thyroid, you will be given medication. One is capimazole or propylthiouracil to take, so that the symptoms of hyperthyroidism are lowered. Now, what if you have a condition we call hypothyroidism? Your thyroid is unable to produce enough amount of thyroid hormones to function normally the way the thyroid is supposed to function. So you'll be given what we call levothyroxine to do what? To improve or to manufacture or to produce the two hormones, the T4 and the T3. Another way they can treat goiter is through what we call watchful waiting, meaning there is no treatment. Why do we say that? People with mild nodular goiter, many times they don't even require any treatment. The only thing is done is to do a regular checkups to see whether the thyroid has got any changes. So not all goiters are treated. So we can treat goiter in those 4 ways: surgery, radioactive iodine treatment, medication, and watchful waiting. Now, does goiter go away on its own? Oh yes, it does. Again, remember I've just said mild nodular goiter doesn't need any treatment. So it can go away by itself. How can we prevent goiter? Goiter can be prevented if you have what we call simple goiter, the one which the entire thyroid gland enlarges in size and it doesn't affect the thyroid hormone balance in your body. When this is actually when you have what we call deficiency, iodine deficiency in your body. So this one can be prevented. How? By taking iodine. Iodine, we can get it through the diet, the seafoods or the seaweed. Others, we can get them from foods or plants which are grown in iodine-rich soil. So up to that level, or up to this level, I believe I've talked much. Or you have gotten something concerning goiter. Maybe if you can do a summary of this, we started by defining goiter. We looked at the anatomy, the structure of the thyroid gland, the hormones produced by the thyroid gland, the functions of the thyroid gland, on how can we associate goiter. You can associate it with the normal thyroid hormone levels, euthyroid, or irregular thyroid hormone levels, hyperthyroidism or hypothyroidism. We looked at classification of goiter. We said we can classify goiter the way it grows all on the level of thyroid hormones. Anyone can get goiter. It doesn't matter if you are a child, but the risk increases when you're above 40 years. And also we looked at the symptoms of goiter. And then we came and also looked at the symptoms. If you are hyper or you are hypo, we have looked at the causes of goiter, the diagnosis of goiter, treatment of goiter, and we have answered the question if goiter can go away by itself. Thank you so much for always checking on my videos. I love your company. And if you have gotten something or you feel there is somebody you can share this link with, kindly share the link. Give the comment down below. Maybe how have you been getting this now? Most of the people, when they get somebody who has a swelling on the neck, they even fear looking at that person. No, that is a medical condition which is treatable, manageable, and then you can get assistance if you get to look for the right specialists. Thank you so much. Let's meet in the next video. Bye bye. Thank you.